जो चकमक में आग तेरा साई तुझ में है तू जाग सके तो जाग. Friends, this doha is from Kabir ke dohe. I think we've all studied in our school and college life. Those who don't understand Hindi, I would like to translate it in English. Just as a seed has oil and a spark is the essence of light, divinity lies within you. Realize this if you can. So each one of us has this hidden divinity. And no, I'm not going to talk to you on spirituality today. It is about Eyecare. I bring a lot of greetings from my entire team at Zamindar Surgical Eye Center. And as somebody said that, मैं अकेली ही चली थी जानिबे मंजिल मगर लोग साथ आते गए कारवां बनता गया. You have met five members of my team already. About somewhere in the year 96, maybe some of you were not born also in that year, I started working with ITC tobacco division, which was housed here. And I used to do eye checkup. I alone used to come and sit in the ambulance room in the ITC tobacco and check eyes of the employees. And that's how I have a very deep connection with ITC. ITC was instrumental in giving my small practice, which was in Jai Bharat Nagar, a little boost. And from those days in the year 96, 97 to today, in the year 2022, we have developed into 3 eye care specialty hospitals. All our hospitals are NABH accredited, and we are this year's award winner, National Award winner for a patient-friendly hospital by Association of Healthcare Providers of India. So yes, thank you so much. Sitting here, you all deserve that gratitude because somewhere you all also work for ITC, with another division, but yes, and we still have a very robust relationship with ITC Tobacco Division. We still do their eye checkups for their forklift drivers, and we are very, very well connected with them. Thanks. The slides get over here. Okay. Who has seen the movie Sholay? Anybody? Wow, I'm impressed. Sitting in a city like Bangalore and a typically non-Hindi speaking kind of an area, if you've seen Sholay, that's good. Thakur ने एक dialogue बोला था, लोहे लोहे को काटता है, right? Thakur told this to both Amitabh Bachchan and Dharmendra. Why am I talking about this dialogue of Sholay? You know, we all have so many apps now, and now there is an app which blocks apps. You all know about that, right? So that's the reason why I said that loha hi lohe ko katta hai. Only an app can protect you from other apps, right? So that's true. We live in a digital world. What is that new thing which came up in October 6th? Metaverse. Who has heard about Metaverse? I'm sure you guys are definitely more technologically savvy. I was a little shivering, oh my God, I'm going to go to a smart bunch of people and I should not look very novice. So I did a little bit of my homework and came up with this word, Metaverse. Metaverse. Are we all going to be in Metaverse where everything happens digitally? And now I come into the avatar of my eye doctor. I really don't like this at all. So, have you heard about these words, digital minimalism and digital detox? Right? Who is, anybody from Maharashtra over here? Nobody? Oh, wow, that's fine. Maharashtra has a Sangli district. And there's a small little village in Sangli district. I am so impressed with that village because they have found a way to do digital detox. And how is a digital detox done? At 7 p.m. every day, an alarm goes off. And that means all electronic items closed, mobile phones closed all across the village. For how many minutes? 90 minutes. And those 90 minutes are for real life interactions. Yeah? You have your family, you have a real life. Without that phone always there, you know. So this is something which we have to learn from that small village in Sangli district in Maharashtra. When I come and I don't know, Sudha, I should ask you, how much time do I have?
You might continue, ma'am.
No, I have about 15 minutes, half an hour.
30 minutes.
30 minutes, excellent, thank you so much. So I know how to compartmentalize my time. When I come here, I turned 53 this year. I don't want to just bring my experience as an eye doctor. I'm a mother of 2 grown-up children, and I see many of you are looking like parents who would have had their own children, young people who tomorrow will become parents. Are we looking at digital devices being the mainstay of our family life. And then what kind of children we are going to have, what kind of family life we are going to have, right? These are more profound questions. I am greedy of your time. I am greedy of the knowledge which I can share with you, not only for Eyecare, but the profound knowledge which I've gained bringing up my 2 daughters, and how much time really goes wasted in looking at the multiple clutter in your mobile phone, right? So minimalism, digital minimalism is all about stopping multitasking. There's this new wave of information which came that multitasking is great. Wow, multitask. Yes, you can achieve more in that 1 minute. No, it is not. Neurologists, scientists all over the world now agree that multitasking is definitely not a good idea. It actually invites you to clutter. It removes the focus. It removes optimization. So let's not worry about multitasking, let's focus, and that's the reason why, for more profound reasons also, looking at the mobile phone is not a great idea. Besides that, what does the mobile phone do? Mobile phone has some ionizing radiations, radio frequency waves. That was thought about a few years back, and now people, I don't know, it's all industry-driven business and marketing-driven work. They say now there are no more ionizing radiations, they've all gone away. So I don't know who to believe, but I do believe that there is some harmful rays coming out of mobile phones. And all digital devices have blue light coming out of it. We believe that there is blue light, right? How many of you are aware about the melatonin effect of the blue light, right? We all know that melatonin is the hormone needed in our bodies to get sleep. And let's be candid, let's be honest, let's ask ourselves this question. How many of us actually typically have a mobile phone in our hand the last thing when we are still going to sleep in the bedroom? And then there have been nights when we have struggled to get sleep. Friends, that's the answer. Your melatonin is not enough in your body because the blue light out of your digital devices is blocking your melatonin, right? And then you don't get sleep. And lack of sleep, India is still a little behind in sleep doctors. In America, you have sleep doctors, and you go to these sleep doctors to get how much, to learn how to get better sleep, because every doctor you go to, any doctor, you name it, and they will ask you one question: do you sleep well? For ophthalmology, for eye care, diseases like chronic open angle glaucomas are seen to have progressed more faster in people who don't sleep well. So sleep is related to everything, right? The most fittest of the person who hits the gym every day has got a heart attack and dropped dead. And if you ask them what was the only thing which was common in all those people who had similar heart attacks, they all did not sleep well or slept for 3 or 4 hours the night. So sleep and melatonin. Okay, so these are much more profound reasons why you should limit and believe in digital minimalization. Okay, besides the fact that you as parents, or maybe to be parents, or parents in the future, are going to role model, right, for your children. You cannot tell your child that you don't see mobile phone and you are on the mobile phone all the time, right? Because there is some disorder known as myopia or short-sightedness. We've all almost come out of this pandemic now. Almost nobody is wearing a mask, so I believe except few of my team that we are really feeling safe about, okay, chala gaya hai, right? And there is another pandemic looming, the pandemic of myopia, of short-sightedness. Every other child who comes to us is short-sighted, right? And is it all free? To go to an eye doctor, get your eyes tested, go and buy glasses. This all is very cost prohibitive. What about those children in the villages? Now mobile phone has reached everywhere, right? And it is a costly affair. A lot of money goes into buying glasses, going to an eye doctor, getting it checked. And a lot of our children in India do not have the privilege or the access to this kind of facility, and they suffer. They're not able to see well, they don't do well in school, right? So yes, vicariously somewhere we are all responsibility. This entire culture of mobile phone is responsible. So we need to understand that There are a lot of anxiety-related issues with using mobile phones so much, right? People who continuously, there's a digital addiction which happens, and children who are not ready to face a human being face to face. They want to just be safe and secure in their digital world. Definitely we don't want to have, these are the citizens of India, the future citizens of India. So who will be finally responsible? This generation, our generation, will be responsible for those, the next few generations who become recluse, social recluse. I've scared you all enough, isn't it? I wanted to scare you all. Please take care of your eyes. Please stay away from your mobile phones. Please, 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 right? You will be doing a favor to yourself, a favor to your families, a favor to the society at large, right? Be that one person, be the crusader and say, I will do it, and you can do it. So this was the first part of my talk. The second part of my talk comes to refractive errors. I see quite a few of us are wearing glasses, right? Wearing glasses and taking care of glasses is very important. If you have the minimal number, if you have an astigmatic number, and you might say, I'm having headaches, but so somebody will say, आँख थोड़ा check करा लो. अरे नहीं अच्छा दिख रहा है सब कुछ. Very good. I'm seeing everything clearly. But my friend, you might be having a small number, an astigmatism, what we call a cylindrical error, which is giving you eye strain at the end of the day, right? So this should not happen. You should take a try and get your eyes checked. And then आँख check कराना है तो कहाँ जाओगे? बगल में एक चश्मे की दुकान है, right? An optical store next to you. Will that be the place you will go? You might go later to maybe buy your glasses, but the first checkup should be an ophthalmologist. I was speaking with Dr. Rose just now as soon as I came to find out how is the general eye health of the employees of ITC Food. And she did tell me that there were a few of you all who have a suspicious glaucoma. There are one of them who had some retinal issue also because of diabetes. So here you see, it's very important that you get a thorough eye test done with an eye doctor. It's very, very important that you do that. It's very, very important, right? Because we dilate, we completely examine, we look at your optic nerves, your retina, we check your eye pressures and find out if there is any early. Eye care is about preventive eye care. You can prevent diabetic retinopathy. You can prevent glaucomatous optic nerve damage. Just drink some water. Meanwhile, I wanted to tell you that please keep some questions ready for me because I'm going to speak only for the next 10 minutes and then I would like to answer some questions. So refractive errors. Now I come to the part of my talk which talks about simple things what you can do in a day-to-day life. Normally when you get up in the morning, what do? You want to wash your face. How many of you go to the tap and open your eyes and wash your eyes from inside also? Like keep your eyes open and splash water inside your eyes. How many of you do that? Nobody? Nobody washes the eyes from inside? That's fantastic. Please don't do that. Please don't do that. You don't have any business of washing your eyes from inside. And that also you're going to put tap water inside your eyes. You're disturbing your normal, natural tears. So it's not that only when you cry there is, the tears roll down your cheeks. There is normally a layer of tears. This is the nutritive, lubricating fluid which is there in the front of your cornea. This central black portion, what you see, is known as cornea. And this cornea is avascular. It doesn't have a blood supply of its own. So where does it get its food? Right? All of our other cells gets food through the blood supply, right? The oxygen through blood supply. How does it gets through the tears? And the moment you wash your eyes from inside with water, the tears all go away. So you need, and when you continuously look at the monitor, the computer monitor, what happens? Your tears dry up. You have dry eyes, right? So you need to always see that you take breaks every 20 minutes. Look away from the computer screen at something 20 feet away for at least 20 seconds. That will allow you time to blink, get some more tears in your eyes, and it will also relax those small ciliary muscles of your eyes. There are these small ciliary muscles which will go in spasm. Imagine you go to the gym and you're doing your biceps like continuously. Can you do that? You guys are doing that if you're continuously looking at the screen. You're continuously using your ciliary muscles. You need to relax. That's something very important. Please do that. Please take away that time. And in fact, I was invited when Mr. Anand Talwar was there in Infotech a few years back, and one of your employees told me, you know, Dr. Saab, I take breaks and I ensure because I drink a lot of water. And when I drink a lot of water, I need to take a lot of break to go to the... So I take breaks automatically. That's a fantastic idea. Drink water and take breaks. Sorry. So this is what I want to tell you, that dry eyes is very common in people who use computers, and this could be one of the reasons. Another one thing which I wanted you all to understand is that, you know, there are these lids, the eyelashes and the lids. What we typically do when we are working on the computer, we are touching everything and then touching the eyelids. So what happens? You develop infections around the eyelashes and around the lids. And these infections will block your normal tear secreting glands. What we call it as mebominitis or blepharitis. I'm sorry, I have an issue with this AC, you know, so that's fine. So that you can't do anything about it. And go slow. So this mebominitis or these tear secreting glands which gets blocked, they will again deplete your eyes of tears, and you have a problem with that. Moreover, what you eat every day, why is it so important? You eat nuts, you eat fish, you eat, you know, your proteins. These are all helping you to make healthy tears. How many of you go out and walk after the lunch in the sunlight? Why is that very good, excellent, superb, superb, superb. So that sunlight, why is it important for the eyes? Yeah, I know we get some vitamin D from the sunlight, but eyes? Yes, the tear secretions, the tears also depend on vitamin D in the body. Also on vitamin B12, right? So I hope you're eating enough rich sources of vitamin B12. It comes from meat, from egg, or then take vitamin B12 supplements, right? So if you're having dry eyes, that could be the reason. You're getting my point. Vitamin D, vitamin B12, antioxidants. And always, whenever you have a little eye pain or you feel that there is something stuck over there, close your eyes and do some hot fomentation. Clean your eyes. If I see a few ladies here who put some makeup, fantastic. Please do use makeup, but remove it in a very hygienic way, right? Don't let the makeup clog your tear secreting glands. That's very, very important. So these are simple tips about eye care. How many of you I have done that. I'm sure that because I'm an eye doctor, I can do that. But how many of you have gone to the pharmacist and said, my eye is hurting, just give me some drops? You've done that? Right. That's very candid. Thank you. Thank you. Please don't do that. Or if you are doing that, remember that there are some drops which have steroids. There's one very famous drop, Ciplox D. And we are all, of course, very educated and evolved people, and we would read and understand that D stands for dexamethasone, which is a steroid, and we don't want that in our eyes for a long time. But there are children in rural areas who use these steroid drops for a very long time for eye allergies, for redness, and they end up developing glaucoma and cataracts. So please, when you want to put an eye drop, use some lubricating drops. They are safe, you know, like something like a tear supplement drop or something. Read up on it, carboxymethylcellulose or sodium hyaluronate drops. They're safe drops, you can use them, but not just any drop. And an antibiotic drop just for everything? No, that's not a great idea at all, right? Last month we had the World Pharmacy Day, and I gave a talk, and all these talks are on our YouTube channel. A lot of informative eye care talks are there on Zamindar Eyecare YouTube channels. Please use that. On the World Pharmacy Day, I told the pharmacist in a very nice way that thank you for not giving eye drops without the doctor's prescription. Thank you for reminding the patients if you're giving steroid drops that there is a steroid in it and you cannot use it beyond a point. So these are very important things. Moreover, we do take tablets, right? And then what do we read behind the tablets? The expiry date. And we say, acha, abhi 2024 tak chalega. No problem. We can keep it in our, first aid kit or something like that. And then we buy eye drops and we do the same for that. Like, okay, I was paining, I put some drop and I safely keep it back over there. Is it okay? The expiry date is 2024. But can I keep this bottle for a longer time? No. Cannot. Because the eye drop has very good, thank you, has a shelf life of 1 month. After you open the drop, within a month you have to throw it away. But because otherwise it will get contaminated and give you more infections. How many of you wears contact lenses over here? Anybody? Nobody? Very good. Fine. If you're wearing contact lenses or if your friends are wearing contact lenses, please let them see this video which we have on our YouTube channel. 20 things contact lens users should never forget. Right? 20 things. Because we have, Dr. Rose will agree with me when I tell you that we have seen some horrible corneal ulcers following contact lens use. And in my practice of 25 years, I've seen a couple of eyes lost because of irresponsible contact lens use. Right? So this is very, very important. Now we come to the last part of my talk. The part about preventive eye disease. Yesterday was the World Prematurity Day, and why World Prematurity Day is important for eyes? Because premature children can develop retinopathy of prematurity, right? And this can be vision threatening, it can damage the eye. So if you have, I want to empower each one of you with this knowledge that if you have friends or family who are giving birth to a premature child, please ensure that they get their eyes checked. Because ROP, if detected timely, we can save vision loss. This is one of the commonest cause at birth. How can you prevent further loss? Second is common cause for preventive blindness, of course, is cataract. If you don't get your cataracts removed, your cataract can cause glaucoma, and then you eventually lose eyes. So of course cataract is important. Cataract in modern day can cause a lot of glare. It can cause issues like you're not able to see, so you fall down. So if you do have elderly people at home, please get them for cataract evaluation and a surgery in time. Don't wait, abhi mature nahi hua hai. Gone are the days when we used to wait for the cataract to become mature. Now we do cataract at a very early stage. There's no point waiting once a cataract is developed. And the technology with which we do cataract surgery is known as MICS. It's the most advanced technology. Whatever you get the best in the world is what we have at our center. We are a center for excellence in cataract surgery, and so cataract surgery has now also become a refractive surgery. That means you don't need to wear any spectacles after putting the intraocular lens. Diabetes, I have to mention, I'm sure a few of you must be diabetic, and please do not forget to get your retina checked once in a year. Because you know what is diabetes? I want you all to understand. If you have family members who are diabetic, that if you're, this is my kingdom, and this is the sarhad, the balls are the sarhad. So we as eye doctors, we stand on the borders of the sarhad, and we have to keep looking for any enemies to come. And we have to detect the enemies when they are outside our boundary wall. Those are the newer blood vessels or the hard exudates or something like that. And we have to kill them with laser. The moment they enter our sarhad, while we are killing them, what happens? We are killing our people also, right? And we don't want to do that. So that's why it's very important that diabetic people come for regular diabetic retinopathy screening. Very, very important. Glaucoma is a disease, it's known as a silent thief of sight, and anybody who is about 40 years of age should get their glaucoma evaluated. If they do have glaucoma, screening for glaucoma. I think we have done here today for a few patients, we have advised them to come for a detailed checkup if required. That's very, very important that you check your eye pressures. It's a simple, just 1 drop a day can save the complete vision loss. Glaucomatous damage doesn't happen over a few days that, okay, I have glaucoma now, today I'm seeing, tomorrow I can't see. It happens because of decades of neglect. So decades if you've not gone to your eye doctor and just got your chashma made with the next chashma wala, this can happen. Please remember, glaucoma, retinopathy of prematurity, diabetic retinopathy, cataract are important areas of preventive diseases. Myopia and short-sightedness, I told you about the pandemic. We can stop it by encouraging our children and ourselves to do more outdoor activities, to do more activities with the family, get the board games out, right? Do stuff like that. Go for hiking, trekking. Get those days back in our lives. And then for more reasons than one, please do that. Thank you so much for all your time. If there are any questions, I'm very happy to answer them. Thanks a lot.
Thank you, Dr. Samina. Friends, the floor is open for the questions. Please do ask her. She's comfortable taking questions in Kannada, Hindi, Gujarati and English.
Yeah, Gujarati definitely, yes.
Please do ask.
How safe is use of contact lenses?
You wear contact lenses?
No, I don't.
Okay.
Just wanted my...
Achha. So he's asked about contact. So that's exactly what I was saying, that it's safe, provided you do those 20 things. I was telling you 20 things, we have a video. 20 things with contact lenses. I've had young people who have been so rash. You know, you need a solution for contact lenses. Just, they've used their spit. So, how, I really don't know. That's why, you know, I'm telling, if you wear contact lenses, fantastic, but just take care. There are a lot of things which you need to be taking care when you're wearing contact lenses.
Now, would you prescribe a normal spectacles or a contact lens? Given a choice?
No, given a choice, it's the patient's choice. But if there is a very minimal number or something, I would give a spectacles. If the patient is in that kind of a profession where wearing spectacles is going to hinder, if you're a dancer or a performer or an actor where you can't wear spectacles all the time, or sometimes even sports people, they wear contact lenses, but they have to be, it's a serious business. You know, you're putting something in your eyes which can take infection into your eyes. It's not scary, you just have to be responsible enough. So in my practice, we don't give contact lenses to anybody who is under the age of 16 or 17 years of age. Any other questions? Anybody who is very happy to answer. Yes, ma'am.
Doctor, as you said, now this generation is already intoxicated with the digital world. So, being as a parent, what can we do? What are the precautions we can do for our child to bring out of that?
Fantastic question. The first thing is, if your child is 3 or 4 years of age, go for a complete eye checkup. You will get, now we do a test which was done here also, an autorefractometer. Normally for a small baby, the autoref reading should be in the plus. But in that baby also, if you're getting a little bit of minus, even I'm not even thinking about giving glasses to the child, but if it is showing a little bit minus on the autoref, I'm already getting these signs that this child could be myopic. And chalo beta khana kha lo, mobile pe kuch dekh kar, that has to stop completely. Right? They cannot. What will happen? They will not eat food for 1 meal or 2 meals, but then they will eat food. Mobile may, no, what happened to mothers like us? We've had children and we never had mobile phones. So how did they eat food? Right? So these kind of things are very important. And I love this question because I wanted to talk about it. Myopia is like, there is myopia ki bus ja rahi hai. Okay? Either you are in the bus or you are outside the bus. Matlab you have not got any minus numbers. I'm talking about children specifically. Now when you get a little myopia, a little minus number, that means you've already boarded the bus. Now bus is going to continue. Your myopia is going to progress. So the first thing what she asked is that bus mein chado hi nahi. Don't get into the bus. How you do that? By stopping the exposure of digital devices in children. Right? By getting them good food. By exposing them to sunlight and outdoor activities. Okay, yes, few of them might have a strong genetic history, right? So they might develop it, but for them also,
we can delay. Jitna aap delay karonge to get into the bus of myopia, the better. Because you remember, once you get in the bus, you are going to travel. And then now we have programs like myopia control in our hospital. So we have medicines which we give them, children, to put 1 drop at night so that the progression slows down. There is nothing available still to stop the progression of myopia, only to slow down. So there is a myopia control program we have at our center which does this. There are special kind of spectacles available now which helps in reducing the progression of myopia. So thanks for the question. Anybody else, please?
In addition to that, I have a question.
Of course.
What is your suggestion to take care of day-to-day care that we can take care of the children's eye?
Yes, I love that. Blessy, please come. Please come. So Blessy is going to tell us and teach us a few eye exercises. That's not just for children, but for all adults also. Can we do this? Let's be a sport, huh? Let's all do
having
this.
a session after lunch. Please open your eyes now. This is very important than anything what we heard so far.
Sudha, thank you so much for the question. Yes, Blessy. Let's start.
So I'll be doing few exercises. So you can all do it along with me, so that further you can all do it when you are free. Okay. So at least once in a day, this will be good. Okay. The first exercise is, you'll have to place your finger in front, either your pen or your finger. Okay.
Let's do this here. Come on. Be a sport.
And just keep looking at your finger and bring it closer to your nose. And then take it away. Okay? Again. So for about 10 times. This should be at your arm distance. Okay? And then again bring it closer to your nose and then take it away. So you'll have to do this 10 times at one shot. So it should be about 3 times. So 30 times. Okay? It's very simple. So this is one exercise. This is to relax our eye muscles especially. So when we sit focused on something closer, our eye muscles will get spasm. There are chances for spasm. So it's just to relax the muscles. And the second exercise is, you have to rub your palm very tight, very fast, and then place it on your eyes with your eyes closed.
It's known as palming. I think we do it in yoga, isn't it? Palming. Right. That increases the blood circulation of the eye muscles. And it's good. It relaxes you.
And the third exercise is, you'll have to place your thumb in front at an arm distance, and then you'll have to take it towards your right. First your right hand. So you'll have to look at the tip of your right thumb. Without moving your head, you'll have to look at your right thumb going there. And then again bring it to the center. Okay? Same with your left hand also. Okay? So you shouldn't move your
head. It's an eye movement. You're doing extremely left, extremes. Your eyes moving towards extremes.
And the fourth exercise is, you'll have to place them at 90 degrees. One hand here and the other hand towards your right. Okay, and this is only your eye movements. You'll have to move your eyes from this end to this end, where your other thumb is placed. So you'll have to look from here to...
Your head remains straight. You're not moving your hands. Only your eyes are moving. You're looking here and then you're looking there.
And then again you bring it to the center. Okay?
The same things are on the other side. Look straight.
And the fifth rule is a very common rule which all corporates will be knowing, 20-20-20 rule. So in between, ma'am had already said it, in between 20 minutes of work, look at something far for 20 seconds and just blink 20 times.
Thank you, Blessing. So a normal human being blinks about 13 to 16 times in a minute. But when you stare at the computer screen, your blinking rate reduces. So you'll have to consciously, something which you were doing subconsciously, now you have to do it consciously. So blink, 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 and with every blink, there's a new tear circulation, a new tear film which comes in your eyes. God has given us a tear production and a tear drainage. And with every blink, there's a new layer of tear comes. So do not forget to blink.
I have a question. What is your opinion on LASIK surgeries? And if at all, if someone has opted for it, so what is the care that they have to take?
Thanks, Sudha. So LASIK surgery also has come a long way. You know, previously we used to
know about the LASIK, like the benefit of people if they're not aware of what is
LASIK is laser in situ keratomeliosis. It is a way in which you alter the curvature of the cornea so that you can see without glasses. If you've got a minus number or even a plus number, you can remove that. Even for people above the age of 40, there is something known as a press bion LASIK, which will remove their near vision, it will correct their near vision also. So, and LASIK surgery previously was done with a different technique. Now it is done with a technique where there is a very small incision and it's very, very safe. It is known as a smile LASIK and it's doable. Only thing is that there is a suitability criteria for LASIK. LASIK is not for everybody. So there are some tests which we do, test for the cornea, whether it's strong enough, and then test of the retina, whether it has any peripheral degenerations or holes, and then we need to take care of the retinal issues first before we do something on the cornea. So if the suitability of the patient's LASIK is checked, Sudha, then it is a safe procedure. And of course, it goes without saying that we are very conservative for any diagnosis, any treatment, any newer treatment option also. Before we offer to our patients, there is a general bottom line is that the guiding principle is that we ask ourselves, if it was I who was undergoing that or my family member undergoing that, will I do this? And the answer is yes, then we will advise the patient. So there are a lot of LASIK patients who come to us very eagerly. We might have to disappoint them because we have very strict criteria for selection of patients for LASIK surgery.
So what are the precautions that we have to take care of post-surgery?
Post-surgery, there are some drops which you have to use for a month, and some patients will develop a little bit of a dryness for a longer time after LASIK surgery because you are cutting a lot of corneal nerves, right? And that induces dryness, but that settles down. Basically, if LASIK surgery is done in a suitable patient, then the complication is not there.
Any questions?
Any small particles or any dust enter into the eye. Quick method is generally traditional method. You take a bowl of water and open the eyes. So is it advisable or is there any specific method?
So that's of course, well, if you really don't have anything you want to do that, and you will do that, definitely, that's okay. Use your RO water, if you get that, Pine ka pani, that's better, right? Little bit at least, some germs you are not putting inside the eye. Secondly, if you have any tear supplement drops at home already, or you can quickly get something from the medical store, use a lot of that, that's also going to help. And then if still there is a foreign body sensation, please don't tell, just see there is something inside and somebody will remove it with their bud, or don't try any experiments at home. If you find an eye doctor nearby, please go. There are ways and means by which we remove it in a very safe manner. But that's okay, of course. Some chemicals, if they go inside your eyes, then you need to. You can't wait till, I can't use water now. No, you have to do that. Because you have to see who is the bigger enemy, the chemical or the water. Any other questions? Thank you so much. I really appreciate the time what you've given us, and I hope that you all, wish you bright days ahead. I hope you take care of your eyes. You spread this information, this knowledge to your family, friends, your community. And remember that there is a center very close by where there is a Thursday OPD from 9 to 7, which is completely free. It's only 100 rupees registration. So if you know people who cannot afford, please encourage them to come to our Jai Bharat Nagar Center, which is opposite Orion East Mall. All Thursdays are free OPDs. Thank you so much.
Thank you, Dr. Samina, for the valuable insight and the